Okay, let's talk about supplements. And like, I'm just like, oh my gosh, there's just so many supplements. So make this as easy as possible for us.
Yeah. So the first thing is that, any supplements I talk about, of course, making sure that people are speaking with their doctor, because everyone is an individual, and you should be speaking with your doctor to make sure that supplements are right for you and that they're not contraindicated with medications and whatnot, or contraindicated in breastfeeding. So, obviously omega-3s are great. Go ahead.
Just to stop you, in my mind, I don't know if doctors actually know supplements. Like, I know they know medicine, but do they know supplements?
Some do, most don't.
Okay.
So talk to your naturopath, talk to your holistic practitioner, herbalist, whoever you're working with. Just making sure that you're doing your research and not just saying, oh, well, Jessica said take this, so I'm going to do it. Like, I don't have responsibility for that.
Disclaimer, do not just buy everything that Jessica's talking about, because
we can talk about what supplements, have been shown to help with hormone balance, or just to kind of keep yourself or address some of the things that maybe, driving down libido. So in general, looking at a good omega-3, because that is going to give you a good healthy fats. It's going to help with hormone production. It's going to help with driving down inflammation. So that's really important. I really love vitamin D.
Yes.
Vitamin D is a hormone. Okay. And when vitamin D is deficient, we see menstrual cycles go all over the place. We see PCOS, we see endometriosis, we see fertility issues. So vitamin D is linked to so many reproductive conditions, including low libido. And so making sure vitamin D is where it needs to be. Test first before you take vitamin D, because it is a fat soluble vitamin and you can overdose on vitamin D.
Right.
I also really like zinc. Zinc is a precursor for testosterone, right? So if you're assuming testosterone is low, zinc can actually help bump up those testosterone levels. I don't know if you've probably heard of maca.
Yeah.
I love maca root because it's an adaptogen. So it helps you adapt to stress and just keep that cortisol level feeling more balanced. It's a natural libido enhancer. It increases stamina and energy. It's great for both men and women.
Right.
So if you want to sneak that into your man's morning smoothie.
I was going to say, because I used to do this years ago, and I'm like, do I still have it? I'm sure it's like expired by now, but maca is, so for anybody who's watching is like, what's maca? It is a root, I believe, right? Maca root, dried into a powder. And like you said, you can sprinkle it in a smoothie, put it in a smoothie, sprinkle it on yogurt, your cereal, whatever it is.
Yeah.
Right? Yeah.
Yeah. I do love maca for that. And there's other adaptogenic herbs too, like ashwagandha and rhodiola, which are beautiful herbs that people can incorporate if you do feel like that stress and that adrenal piece is what's affecting you. Staying on a prenatal vitamin, I love that. It gives you all your B vitamins in higher doses. It gives you the folate to help with testosterone production and all these things. So I usually encourage women to stay on their prenatal vitamin as long as they're breastfeeding, and if they can, even longer. It's a wonderful multivitamin. You could do B6. Vitamin B6 is a wonderful herb to help balance estrogen and progesterone. So there's so many different supplements out there, but I would say working with like omega-3s, vitamin D is a really good place to start. Omega-3s are always fantastic. Both of those, omega-3 and vitamin D, have been shown in research to improve depression.
Right.
And if you're having low mood and a depression and anxiety, that could be the underlying factor in low libido, this could improve it. If you're having gut issues, probiotics are always beneficial. The gut is like a major hormone producer, right? So anytime we're trying to balance hormones, you have to balance the gut out. Because if your digestion's all over the place, you're likely not going to be metabolizing your hormones effectively.
Right. That's a really good point that I didn't think about, but I want to get back to the supplements. So I know Jessica's talking a lot about if your hormones this or high or low. So for those of you watching, how you're going to find this out is by getting your hormone panel done by either your doctor or naturopathic doctor would you prescribe it? How do you
requisition it? So what women need to know though is you can't just test your hormones randomly at any point in time. Like if you're still breastfeeding, there's no point. Okay. Your hormones are going to be likely all really low. Okay. And so you don't want to just assume, well, my progesterone's low, right? It's like, well, it's because you're breastfeeding. So you can test though your vitamin D, you can test your thyroid at that point, because we know thyroid, when that's out of whack, will drive down libido, it drives down testosterone. So it does play a huge effect in sex hormones. But also you can just even look at your iron levels and your B12, which could play a role. When you're no longer breastfeeding, then you want to make, or when your period returns, this is where you want to test most of your hormones on day 3. So definitely like your estrogen, your follicle stimulating hormone, luteinizing hormone. I know these are huge words, but most of the hormones that your doctor is going to test, you want to make sure you go on day 3 of your menstrual cycle. If they're testing at any random time in your cycle, it's not going to be accurate.
Okay.
And then you want to test your progesterone 7 days after you ovulate.
Okay.
So progesterone should be at its highest point at that time, if there's no pregnancy. So you want to make sure you're testing at the right time in order to get really, really good results.
Right.
Otherwise, you're just going to assume, oh, everything's normal. And you want to make sure you have a doctor that interprets them correctly, because there's optimal levels.
And this is interesting because I remember coming to my doctor after my first baby, and I said, I have low libido, and I don't believe, this is like 7, 8 years ago, I don't believe she said, let's run your hormones. It's okay. I will write you a script to go see this. I don't even remember if it was a sex therapist. I have no clue, but I was like, yeah, whatever. They called me like 6 months later, and I was like, I'm pregnant again, so we're good. I don't need this appointment. Right?
So here's the problem. There is a huge issue with women in general in the healthcare system, because we are constantly, like, the situation we're in is constantly blamed for how we feel. It's like, oh, you're pregnant. Oh, you're feeling tired while you're pregnant. Oh, well, that's just because you're pregnant, right? Or, oh, you're tired postpartum. You have low libido postpartum. It's just because you're postpartum, right? It'll pass once, baby's older. Or, so we're just constantly like, oh, like just told that, well, this is normal because you're a woman, and this is what, oh, you have painful periods. Well, you're a woman, deal with it.
Do you think that
or you're
just
put on
so complex?
Or you're put on, or if like, you're like, if your periods are wonky or heavy or whatever, it's birth control. Well, okay, let's go on birth control. Like, well, how about a conversation about why this is happening? Like, what's actually going on in my body? I don't understand it, but I understand that this is the way kind of the allopathic medicine, this is what they learn to do.
Yeah.
So they're doing what they know, which, they do amazing things as well. So you just want to make sure maybe you're working with a practitioner on the holistic side that can maybe look a little bit deeper into what's actually going on and be a little bit more thorough.
Exactly. So what I want to point out is, if your doctor is saying, okay, let me write a script to so-and-so, you can request them. I want to run my hormone panel, and let's investigate from there. Advocate for yourself. And then take that, like you said, doctors might view it differently than you would, a naturopathic doctor. So feel free to take that to a naturopathic doctor to get them to also look at it. But it's interesting that you said that your progesterone, you need to test at a different time than the rest. I have never gone for hormone tests where it's like, okay, you got to do this one on the 3rd day and this on the 7th day. Like, that's unheard of.
Not with the naturopath.
Okay.
With a naturopath, you will definitely, they will tell you, like, when I'm done. The thing is too, like, even going to see if you were going to go see like an endocrinologist, some will be they know about that. Cause I do have patients who come to me and they're like, oh yeah, I did this on day 3 and I did this on day 21, if they ovulate around day 14 with my endocrinologist. So people who actually study hormones, and that's the main part of their practice, but some still don't. It boggles my mind. But you'll notice, like, women going through fertility, they're very specific about when they test women's hormones, but going to see just like your GP, they don't necessarily, hormones isn't their thing, right? So they're just like, okay, let's run it. And then if they see that everything comes back within range, like, it's all good, because it's not flagged. They're just looking for things that are kind of flagged outside of that range. And if it's not flagged, then they're like, it's fine. Right. They do that with thyroid too, because they don't, Thyroid isn't their specialty.
Right.
So if you want to know about your hormones, go to a doctor that like specializes in hormones.
Mm-hmm.
Yeah.
All
Similar
right.
to like, if you break your leg, go see like somebody who like specializes in bones. Don't like, yeah.
Exactly.
Yeah. But you'll get there.
Awesome.
The libido can come back.
We can come
It's not,
back.
it can return. So it's just, finding out where those imbalances are and tweaking it.
We're not in libido jail forever.
No. Although it feels that way sometimes.
Yes. Awesome. Thank you so much for all these tips. This was so great. I know that moms will be rewinding and watching over and over because there's so many tidbits here and there. So Jess, I know you have a lot of stuff on your social media. Tell everybody where they can find you.
Yeah. So the best place to find me is probably through my Instagram. So I'm sure you'll put the link there, but it's Dr. Jessica DuPont, very easy, Dr. Jessica DuPont, and you'll find me there. That's where I post the most. You can absolutely go to my website, drjessicand.com if you're looking to book an appointment. But Instagram is probably where you're going to find me the most. I have a few upcoming programs, one of them specifically focused on postpartum. I can't give out too much information, but this is a really excited one I'm really excited for, because there is no program out there for postpartum moms that address everything from nutrition, regulating hormones, how to navigate breastfeeding and weaning, how to navigate hair loss, and libido.
That's a good
whole
one.
Other topic we could do.
Yes, it is.
But how to, cortisol and all this stuff, because like I said, or like even you said earlier, women, their doctor's appointments stop at 6 weeks postpartum. And that's it. It's like, okay, well, good luck now, have fun. Right. And then you're just left to be like, oh, okay. And so really, like, we need to change that. And women should be getting testing at certain times throughout their postpartum period. So this program is going to talk about that, what to get tested, how to interpret those results, what to eat and how to eat, how to regulate your hormones, how to navigate things, what's normal, what's not normal. And so it's really going to take that all encompassing, and even it's going to address pelvic floor and all this stuff. And so this is going to be launched in the fall, and it's strictly online, so women can do it at their own pace. And so it's just going to give women that information that they're looking for, because Dr. Google, as we know, can cause a lot of stress. It can cause a lot of overwhelm. Yeah. It's like, well, what supplements do I do? At what dose? Like, is this good for me? Is this not good for me? I don't know. And it's like, you're too much on your plate already as a postpartum mom. It needs to be easy, laid out. Okay, this is my plan for me. Right. Because babies have all these doctor's appointments, but what about you? Yeah, exactly. Right? So I'm really, really excited about this one, and I'll let you know as soon as that's launched, but it'll be
and I'll definitely put the link down below when that's out. But everybody, you can reach Dr. Jess. I'll have all her details in the description box below where you can reach her. So thanks so much, Jess, for coming here and being our expert guest. We learned a lot. I appreciate it so much.
Thank you so much for having me. This was amazing. Keep doing what you're doing. You're a vibrant, beautiful self. And keep empowering women. It's amazing.
Awesome. Thank you.
Bye.
Bye.